There are risk factors that are more common in the Aboriginal population compared to the non-Aboriginal population. Diabetes, for example, is more common in the Aboriginal population than the non-Aboriginal population. Also, high blood pressure. There's also other risk factors that are unique to the Aboriginal population, and that would be inflammation. They have a higher risk of kidney inflammation and inflammation in their body that causes kidney disease. There's a higher rate of smoking amongst the Aboriginal population than the non-Aboriginal population. And there are also genetics. The non-Aboriginal population, their risk of kidney disease because their kidneys are ageing starts at 60, whereas the Aboriginal population, it starts after 30 years of age. For women, one of the earliest signs that you've got kidney disease or there's a problem with your blood pressure or your kidneys can be that in your pregnancy that you develop pre-eclampsia, what used to be called toxemia. And that can occur at any time in the pregnancy and is more common in Aboriginal women. That is a sign that things might not be okay. And after the pregnancy, women need to make sure they follow up to make sure the blood pressure goes away or the protein goes away. And if it doesn't, to get it dealt with. So Elizabeth and I met when she had quite damaged kidneys. It was a little bit before she started dialysis. But when you chat to her, you can see that she had lots of risk factors beforehand. But for complex reasons, she never kind of got on top of it.
I always knew that I had a problem with my kidneys, but I didn't understand it.
She had pre-eclampsia when she was pregnant with her babies. She was Aboriginal, and by the time we met, she was over 30 years of age. So they're three big risk factors for checking for her having kidney disease.
When I had my second son, I got a kidney infection when I was pregnant to him. And I was in hospital for a while with him and he was born. I started swelling up. I started suffering with high blood pressure, and they call it toxemia. My blood pressure was going up and up and up. It was putting my life at risk as well as the baby, so they had to bring the pregnancy on.
Things that you need to be aware of that are risk factors for kidney disease are if someone else in your family's got kidney disease, then that doesn't mean you're definitely going to get it, but it increases your risk. If you've got a lot of inflammation, either inflammation in your kidneys that you'll know with blood or protein in your urine, or inflammation elsewhere, so lots of throat infections or skin infection, that also increases your risk of kidney disease. So inflammation is either infection, so skin infections, throat infections, fingernail infections, things that seem relatively minor, but if they're there for a long time, it can confuse the body and stimulate the immune system where it starts to attack the kidneys. Your diet, so eating a healthy diet is good for kidneys. If you don't eat well, that increases not only the inflammation, but increases your risk of kidney disease. So the first thing you can do is get checked, because you don't know you've got a problem till you get it checked. And waiting for symptoms is a waste of time. So therefore, knowing about it is the first thing. So if you've got any of the risk factors or are worried about it, then go and get checked. So an easy way for Aboriginal people to get their kidneys checked is to do a 715 check at their Aboriginal medical service or at their local GP. Simple and quick.